Welcome to The Exam Room, the podcast where we explore how value-based care is transforming healthcare for the better. From probing today's challenges to charting innovative breakthroughs, we're here to dissect what's shaping the future of patient-centered healthcare. I'm your host, Rhiannon Windsor, and we're charting the course through patient engagement. Let's scrub in and get started. We're continuing our conversation with Sonia about engaging Medicare beneficiaries, and we're going to shift our conversation to tips and tricks. What are some practical tips that you have for our listeners regarding engaging patients?
So I would say some of the practical tips are making sure that, one, you do your research, and two, you have general knowledge of some of the resources that you have available to your beneficiary base. Also, making sure that you're approaching all of your outreach the same. It's in your voice, the smile is there. And if you're having a bad day, today might not be the day that you do your outreach. Keeping in mind that you have to approach it with an open mind and your listening ears on. If you're not feeling it today, you're not going to be very successful in your outreach. And maybe today's day is somebody else's time to do outreach.
Mm-hmm. So when you're doing the outreach calls, are you taking notes while you're doing the call, or is that call recorded? And how does that get kind of compiled as a communication piece disseminated
to the team?
Yeah.
We do both, actually. All of the calls are recorded. We do take notes throughout the entire conversation. I can tell you I'm typing frantically in the background. I misspell every other word. I have to go back and clean it up later. A lot of the medical terms I can't spell to save my life. But getting down the gist of the conversation, highlighting things that are important to the patient, that's going to be so beneficial later on in your future outreach or somebody else's outreach to get conversations started and to make people feel comfortable. I take down everything. If they tell me that the post office is 2 blocks away, I record that because it's important for somebody else to know. No detail is too small, and so our notes are crazy looking. But it really helps get to know the patient. And it's not knowledge that's just for me, it's for anybody who else talks to this patient, right? So I can't gatekeep all that information. I've got to put it into the system and let other people read my notes.
Right. And I would imagine that also helps to build the trust and rapport when somebody else on your team calls and they're like, oh, hey, how's Fluffy doing today?
Exactly.
Like I heard Fluffy wasn't doing well the last time we talked to you, or whatever that looks like. But that really makes me feel like you care. Like, oh my gosh, I'm this special person.
Yeah, you remembered my dog's name is Fluffy.
Exactly.
Yeah, that is important. And we talk to a lot of patients, and I cannot remember them all. And I can easily confuse them. So I have to quickly read through the notes again, point out the highlighted stuff so that I know exactly which patient I'm about to call. And you end up with your favorites. I'm not going to lie. You end up with your favorites. And those you tend to memorize. But the rest, yeah, they kind of blend together.
Good. Those are some good practical tips. Yeah, very good. What about icebreakers? Is there any sort of go-to icebreakers that you use?
So initial call icebreakers, asking them how they're feeling today. If you're calling based off of an HIE report, the icebreaker is already there for you because they just were released from the hospital. Mm-hmm. But if you're calling just to do outreach, it's a little harder. Making them know that you're in relation to their health center or working on behalf of their health center, that kind of opens a door. Immediately asking them how they're feeling kind of opens the door, especially if they've had some medical conditions recently. And then letting them go from there. And if you hear a dog in the background, you might talk about the dog. Or if you hear children in the background, you might mention the children, how cute the voices sound, etc. And then that will open up the door. And then again, recording every little detail, because those become the next conversation's icebreakers. Mm-hmm. You do have to listen to everything going on, though, because that does help.
So are there patients that you call that you really know nothing about except for their name and you have their number?
Yes.
How does that go?
I know 3-4 things. I know their name, their age, their phone number, and what health center they should have been aligned to. Those are always interesting phone calls. You just call up and ask how they're doing. And surprisingly, more times than not, they're willing to tell you, especially if they've got something going on and they're not feeling really well. They're going to let you know. So surprisingly enough, it works.
So what about strategies for keeping patients engaged in longer conversations? Do you feel like this is an issue?
No. Once you get them comfortable with you and what it is that you're trying to assist them with, they seem to want to talk longer. We don't base our conversations on the length of time, and we let the patient decide how long that conversation is. And today, they might need to talk to you for 2 hours. The next time you talk to them, they might only have 30 minutes to give you, which is perfectly fine. But you let them direct how long the conversation's going to be. And if they're willing to talk to you, that means you're going to be able to get more information out of them so that you can understand, one, how they're doing health-wise, and two, how they're doing life-wise. And life-wise is just as important as the health-wise. They'll tell you if it's not a good time to talk. They're about to walk out the door, they have an appointment. Can you call back later? Absolutely. And then I just put it on the schedule to do so. Yeah. And I make sure I follow through with that.
So sometimes you only have a couple minutes to, like, what do they say? You never get a second chance to make a first impression. You have this warm call.
Yes.
Right? And so how do you just right off the bat build rapport?
I was just calling to find out how you're feeling today. They don't hear that very often. So I'm not calling for anything particular. You don't have to give me anything. I just want to know how you're feeling today. And they tell you. If you're not feeling well, is there anything that we can do to assist you? Do you have all your medication lined up? Have you been eating? Have you been drinking enough water today? I know it's really hot in your area. Well, it's hot everywhere in here.
It's Phoenix.
It's Phoenix, exactly. Just walking them through and being concerned. I think that takes them off guard. And they're like, wow, somebody's asking how I'm feeling today.
Legitimate concern.
Absolutely.
In your voice. So I was going to ask about like that one tip that seems to work kind of across the spectrum. Would you say that's it?
I would say calling them up and asking every time, how are you feeling today? If you call and you say, hi, Georgine, how are you feeling today? Georgine's going to tell you how she's feeling today, whether you want to hear it or not. And that's important to her. It really starts the conversation. It might be a 10-minute conversation or it might be 2 hours, but she's going to tell you how she's feeling today. She's not going to say, well, who's this and why are you asking? Surprisingly enough, she's going to tell you how she's feeling. They need to know that we're interested in helping them regardless and that we're not getting anything out of it. It's our job to make sure that they're getting everything that they need and deserve.
Thank you for joining us in The Exam Room, where we examine the vital signs of value-based care and diagnose what's shaping the future of healthcare. We hope this conversation on patient engagement was as insightful as your last checkup. A big thank you to our guest speaker, Sonia Sonato, for sharing her expertise and prescribing actionable ideas. Stay tuned for more episodes as we probe the topics that matter most in value-based care. I'm your host, Rhiannon Windsor. Until next time, take care, and thanks for listening to The Exam Room.